Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. This is a brief update on the situation in Sheffield and particularly the epidemiology as of today, 28th of September. In a word, it's hotting up. If you look at the Public Health England weekly surveillance study, which is published week on Friday, it's on the PHE website, you can see that the country, particularly the north of England, but also some bits of the south of England, the rates are going up and up and up. We expect that to continue throughout the whole of the autumn and then into the winter. As of this morning, our 7-day rolling incidence was in the order of 70 per 100,000. A positivity rate is still about 4.5%. So of 100 people with symptoms who get a test, most of them will test negative, and about 4.5%, 4 to 5 will test positive. The incidence is going up pretty quickly. It's doubling about once a week. That's happening across the north of England. Sheffield isn't particularly special there, and we expect it to continue to go up. Over earlier summer, as I've said before, the age profile shifted significantly. The age profile has come down. The average age of a case at the moment is in the mid-30s. That is beginning to go back up, only very slowly, but certainly we've noticed a definitive shift of transmission back into older age groups, which is very worrying. The obvious implication is that we will continue to do all we can to protect those who are most likely to be seriously affected by the virus, and we'd encourage all those people who think they're going to be, who think they could be infected, to continue to wash their hands, keep their distance, wear a face covering, etc., because those things do make a difference. Geography-wise, there's reasonably widespread transmission of the virus across the whole of the city now. It's certainly not contained in one part of the city. It's fairly well spread across the whole of the city. Relatively low numbers, but those numbers do accumulate, and they accumulate over time. Probably infection rates are slightly higher in more deprived parts of town, but it is across the whole of the city. The epidemiology is pretty clear. Most of the infections are happening in household clusters, not really big workplace or school or care home outbreaks, with one or two exceptions, but most of the transmission is in households, and that has implications for two reasons. One, it would be where we put most of our energy and our effort, and two, for members of the public, the question is, how COVID secure is your house? How frequently do you wash down high touch points? Are you limiting your social circle? The rule of 6, for instance. The bigger your social circle, the more chance there is for the transmission of the virus. There's no single explanatory cause for the transmission. There's a whole range of different causes, but most of the transmission we're seeing is in households. So looking forward, we have seen and we are going to see a continued rise in cases, mainly single cases, and fairly diffuse across the whole of Sheffield. We haven't yet got to anything that looks like exponential growth. We haven't yet got to what you would characterise as wave 2. That will likely come. It'd be unlikely that will not happen. So we as a city have an opportunity to change that path. We have to act collectively, we have to act now, and we have to act responsibly. We are working to maximise the available testing capacity that we've got. There's well-trod problems with the national system, and we're working with the Department of Health to maximise that testing capacity. So we know what we need to do. There's been a small increase in hospital activity. I say small, but it's certainly not trivial. We're beginning to see deaths. We're beginning to see COVID written on death certificates again, and that follows a long period of zero. And clearly, those things are worrying. Next few months, we will keep the strategy as it is. The strategy is keeping people safe, protecting those who are vulnerable, reopening Sheffield, and following government advice. We'll keep that strategy. We will be intensifying lots of our efforts and lots of our interventions in all sorts of different spaces, definitely focusing on what we can do around household transmission. We're still seeking to avoid the direct harm of a dangerous respiratory virus that's very easy to transmit, but we're also seeking to avoid the wider social and economic harm as a spillover from those interventions. So we're going to stick with the plan, and the ask of Sheffield is to stick with the plan, to wash your hands, to keep your distance, to wear a face covering, to stay at home if you've got symptoms, and to get a test and get a test early. Concerns, the weather's going to close in, we'll be spending more time indoors than outdoors, and that is more problematic from a transmission risk point of view. So it doesn't change the basics of the plan. So you'll have clocked that the Prime Minister made lots of new announcements when he in his speech to the House of Commons last week. Throughout all of the complexity, the basics are still the same. Wash your hands, keep your distance, etc. So we will continue to focus on those things. We are seeking to basically avoid an imposed lockdown because we think that will do harm to the economy. But equally, government have demonstrated that they are willing to go there and have done that in a lot of places in Northern England. So it's up to all of us to act as responsibly as we can over the coming weeks and months.